actually, I start feeling my mid-back pain in around 1998 when I was in a hair salon. I used to have my own hair salon here in Glendale. So I worked very long hours, and my salon had two doors. One was in the front, one was at the back. And most of the time, I was keeping them open to have a nice breeze, in a salon. So that made sometimes made breeze that the human body cannot take. After a while, cannot take any longer. Why? Because sometimes the breeze was cold, and when you are staying in that situation, environment for a long period of time, what happens to the muscles, it weakens the muscles. So that's how I figured that this was the reason my muscles start getting weaker. And in one day, it was in summer of 1998, I woke up in the morning. I had so much pain in my back, and I barely got up. Couldn't position, couldn't hold my body. It was like out of control. I was having so much pain. It was shock to me that how could this happen within a day. So, but in 2020, I had this. Unfortunately, I met this doctor, local doctor, and he fused my L5S1 in 2020. Didn't go well. So I had so much increased pain, just unbearable. I don't know what to do. Basically, I had 4 spine surgeries. My worst nightmare, my worst pain is my low back. And then I have my second one, I categorized, numbered. So my number 1 is low back. My number 2 is my mid back, upper mid back, T5, T6 in that area, thoracic area. And then my number 3 is my cervical, which is somehow I am dealing with that. That's fine. I have family. I have 2 grandchildren. I'm not enjoying them, basically. Believe me.
I'm sorry.
Yeah, it's a endless nightmare. There is no end to it. I don't see the light at the end of the tunnel. That's to live with that. Your life is like it feels miserable. You feel miserable every second of your day.
Oh, Vazgen, I'm so sorry that you're dealing with this.
Um,
So we're looking at almost 25 years of
that's
severe back pain and 4 operations. And worse than that is that it's all over the place. It's in the neck a little bit, it's in the thoracic more, and it's in the lumbar the worst.
Yes.
Where did you grow up?
In Armenia.
And did your mother warn you about the cold air? Is that where you got this idea of the cold air in the muscles?
Yes.
Is your mother still alive?
Yes.
Ah, very good, very good. Yeah,
No,
is your mother listening to this?
my
Is your
mother.
mother listening to this recording? I hope not, because I'm going to tell you something. I'm going to start with something, and it's basically, I would never say this if she's listening. Tell me if she's listening, but your
No, no.
mother
So
is wrong.
my mother.
Vazgen, your mother is wrong, and it
Yeah.
matters. It makes a huge difference as far as what's going on with you. I want to jump, if I could, right to your scans because they show us what's going on with you. And then once we have that knowledge down and we're in agreement, if we can get into agreement on that, then we can move on to what is the best way to deal with this, okay? we are looking at a cut through your whole body. So let's take a second and look at this. This is your beautiful and healthy brain. And then this is your neck. These are your lungs. And this big thing of your spine is going to be right along the middle. Now we know the spine goes from the top, from the neck, at the base of the skull, all the way down to the sacrum. And in this plane, the spine should be a straight line, but yours is not. So here, this is a bone, this is a bone, but you see they're not going straight.
Yeah, I see that.
They're curved. And then up here, the curve goes the other way to balance.
It's called scoliosis, right?
It's called scoliosis, and my friend, it's what your problem is. Here it curves the other way again, and then it comes to your neck, which is relatively straight. So you have scoliosis. The MRI shows this significant curvature, this scoliosis, and that fits precisely with your pain, which started out thoracic and then spread to the neck and then spread to the lumbar. And the reason is your spine has to balance. And when there's a curve, that curve puts extra torque on the level, gravity puts extra torque on the location of those bends, and that hurts. And the worst thing you can do when you have this is have a fusion, because the limited amount of ability your spine has to compensate for the curve, when you have the fusion, it reduces that a little bit. So, and sometimes you have no choice, and I'm not saying you didn't need those fusions or anything, I don't know, but the fact is they made things worse. And things may have gotten worse anyway, but that is the pattern that we see when the underlying problem is scoliosis. Your problem and the source of your pain is scoliosis. Does that make sense to you?
Yes.
Okay. Now, here's where your mom and these other people could be a little bit correct. I disagree with the cold air hypothesis, but it doesn't matter. One thing that does contribute to scoliosis is weakness in the core muscles. And one thing that makes scoliosis better is strengthening the core muscles. Weaker is worse, stronger is better. And it's very hard to strengthen when you have the curve, because it's very easy, as you know, to aggravate the curve. So now let us turn our attention to, okay, what do we do about this? In spinal problems, we basically have three options. One is conservative care, which is learn to live with it, strengthen the muscles, get stronger get more active in the joints, things like yoga and Pilates and what have you. When that doesn't work and the pain is coming from the joints, the next treatment is radiofrequency ablation, which is where they put a needle in and identify the joints that hurt the worst, because the way that the curvature usually causes the pain is by aggravating the joints. So you identify the joints that hurt the worst and you burn the pain fibers through a needle, and that gives you temporary relief. If you have the temporary relief, but then it goes away and you can no longer get relief with the radiofrequency ablation, then the DVR is a very good option. The problem with DVR and radiofrequency ablation is they make the paraspinous muscles weaker. So yes, they do relieve the pain, but they also do it sometimes at the expense of strength. And so we don't want to go to that first. We want to first really focus, really move hard on the strengthening, ways to strengthen the spine. There's no solution here without exercise. And so you have to use your pain management, your radiofrequency ablation, or even if necessary, your DVR, if RFA fails, you have to use those as a bridge to exercise. Well, from what I'm hearing, it's going to be something that's non-weight bearing and something that allows you to get going. I mean, the best one, the one that's the most studied is yoga. Yoga and Pilates are the best. There's also Tai Chi. Would you consider any of those?
Forget it, doctor.
Not for you? Okay, what about elliptical bike riding?
What is that? Oh, I see. No, I tried a lot of different stuff. It's not happening, and it's just. And by the way, I'll tell you something. I have seen and I met so many doctors, so many specialists here in LA. Recently, I went to UCLA, one of the best doctors, Dr. Hunt, and then so many pain management doctors. They did all this stuff like ablation, nerve blocking, epidurals, all this stuff that you can think of. Nothing helps. So basically, that burning that I have all the time, it doesn't tell you anything, like my low back and my buttocks, thighs, and my legs, always burning. Like,
I think you probably have chronic damage to your L5 nerve roots. And as you've been on the tramadol and your pain threshold has gone down, you're starting to feel things which normally wouldn't be sensitive, but now they are because of the chronic use of the tramadol. And so the combination of weak core muscles and narcotics makes that pain come to the surface, and that's why you feel it. And the longer you continue to eschew, not pursue the exercise, and get weaker and weaker, and your pain fibers get more and more bombarded by the tramadol, so your pain threshold comes lower and lower. As those two things work together, the pain will increase, and there's no procedure that can take you out of this. The treatment is to strengthen the muscles and stop taking the tramadol.
a few days ago, like about a month ago, not a few days ago, a month ago, I went to this place in Beverly Hills. They promised the world. I paid a
They're
lot of.
lying.
Huh?
They're lying. They're lying.
I know.
I don't know them. I don't know what they said. I'll tell you right now, there's no treatment on earth for what is wrong with you other than strengthening the muscles and getting off the narcotics. Those are once you do what we know works, then you can start looking at Beverly Hills. They're lying. Their rent is very high and they need to do very
Yeah,
expensive things to pay
they
the
were.
rent.
I believe that they were lying because they charged me so much money for a couple of minutes treatment, a few shots, and nothing helped. It made my pain worse. They asked me not to take tramadol for first few days, and I went through hell.
Yeah,
I
yeah.
imagine not taking tramadol, not bringing down your pain, and
Mm,
at the same time, cutting
wait,
patients.
wait. So you were going through withdrawal, which is hell. And one way, please think about this differently for a second. Will you indulge me?
Yeah, go ahead.
You were going through withdrawal, and what that should tell you is how dependent and affected your body is by the tramadol. That's not the pain you would have forever off the tramadol. That's the pain of the withdrawal, and you need to give it time to get to the other end. You can't look at that horrible withdrawal and say this is what it would be like off of tramadol. You have to look at that withdrawal, in my opinion, and say to yourself, oh my God, look at what this tramadol is doing. It's affecting every part of my body.
Oh my God.
Oh my God, Vazgid, I bet you're sorry you called me today.
No, no, no. I am learning, I'm just trying to see if there is a way that I can be out of tramadol, because it's the pain, the level of pain I am getting when I don't take tramadol, it's unimaginable. You
I
know,
understand. I understand. And there are doctors which help people make this transition, and they're called addictionologists. There are other medications that can be used temporarily to help in the transition, and that's what you need. The problem is most people go to their pain doctor, and their pain doctor, they just get them back on a different narcotic. And Tramadol, if you're going to be on a narcotic, Tramadol is the best one. So there's no other narcotic that's going to help. And the other ones would be even worse. So I would say you need the care of an addictionologist, addiction, ADDICTION, ologist, OLOGIST. And if you Google addictionologist, and where are you in Glendale or still or LA?
Yeah, Glendale.
Yeah, so addictionologist near me or addictionologist Glendale, find a credible medical doctor who specializes in this, go in and see them. You're tramadol addicted, which is you're not like some criminal drug addict. That's not what I'm
I'm,
saying.
I'm, I'm taking only 3 Tramadols after my breakfast. That's all I do. I don't take like a Tramadol all day long.
I
I
hear you,
take
but
the beating of
unfortunately
the
that's enough. Yeah.
I take the beating of the pain, but I don't take any Tramadol during the day. Only
Yeah.
3 in the morning after breakfast, and that's it.
Vazgen, you're a good man in a bad situation. You're a good man in a bad situation. I can tell that you love to serve others. You've worked in hairdresser. You've done this for years. You love being with other people, and you want to be with your grandchildren. I'm a grandfather myself. I understand that. But I'm telling you, what is separating you from the life you want to lead is not some miracle operation. It's not any particular intervention, and it's not another drug. It's getting a body that's strong enough to deal with the scoliosis. And that there's no straightening that curve at your age. There's no other options. This is the only option. And you need to put your heart and soul and passion into making this transition from being on tramadol to being the strongest grandpa who ever walked down Glendale. You need to be that guy. You need to become that guy. And your grandchildren will thank you for it.
Got it. Thank you,
All
doctor.
right.